ask the clerk to conduct a roll call.
Thank you, Chair. Councillor Bateman.
Present.
Councillor Foster.
I'm present.
Councillor Diodati. Councillor Height.
Present.
Councillor Encina.
Present.
Councillor Jordan. Councillor Kaiser.
Present.
Councillor Olson.
Present.
Councillor Rigby.
Present.
Councillor Seaborn.
Present.
Councillor Cisco.
Present.
Councillor Sorrento.
Present, clerk.
Councillor Whalen.
Present.
Councillor Witteveen.
Present.
And we have regrets today from Councillors Crater and Yip, and Councillor Easton will be joining us a little late.
Thank you very much. I will now call on Councillor Olson to read the land acknowledgement statement.
Thank you, Chair. Niagara region is situated on treaty land. This land is steeped in the rich histories of the First Nations, such as the Hattawandurunk, the Haudenosaunee, and the Anishinaabe, including the Mississaugas of the Credit First Nation. There are many First Nations, Métis and Inuit from across Turtle Island that live and work in Niagara today. The regional municipality of Niagara stands with all Indigenous people, past and present, in promoting the wise stewardship of the lands on which we live.
Thank you very much, Councillor Olson. Point 3, disclosure of pecuniary interest. Is there any? Seeing none, I will move on to 4.1. I'll call on Colin Horn, Manager of Environmental Health, for the presentation respecting tobacco enforcement, public health's role, and future vision.
Good afternoon, Council. My name is Colin Horn, and I'm the manager leading our tobacco enforcement program. I'm happy for the opportunity to present on our role and future vision. The goal of this program is to protect the public and reduce the burden of illness caused by tobacco, vaping, and cannabis products within our community. To achieve this, our team of 3 tobacco control officers conducts 695 annual inspections, 1,390 student test shopping inspections, and enforce Niagara Region's smoking bylaws. We conduct inspections of all Niagara high schools and respond to complaints from the community and agency partners. Our convictions and charges are posted and available to view on our public disclosure website. Within the Ontario Public Health Standards, there is a ministry protocol and guidance document, which provides the structure for our program and establishes the provincial mandates that we are required to meet. Following the strategic review conducted by Public Health, tobacco enforcement is now delivered through our Environmental Health Division, where tobacco control officers are now working alongside public health inspectors. We have reduced duplication and improved customer service by having all inspection work documented in the same software. We have streamlined 2 legal processes into 1, making all public health enforcement more efficient and effective. We have reshaped our service delivery with data-based work areas and officers working 12 p.m. to 8 p.m. shifts, as well as working on weekends. And we've also been able to encompass tobacco enforcement work within our existing model for quality assurance and quality compliance. This is helping us to evaluate this program regularly and consistently to improve population outcomes and the quality of our work. Our focus has been to align with Council's priorities and to transform service delivery in a way that supports an effective and equitable region. This year, we've been working hard to transform operations through innovation, collaboration, and fiscal responsibility. We have modernized the program by innovating with digital inspections and referrals, and we're now the first public health unit in Ontario to establish a digital filing and approval process with the courts, saving mileage and time. We're collaborating with Niagara Regional Police and local secondary school boards, and we have modernized our financial system and mileage reimbursement model, creating efficiencies and reducing operational costs. This is allowing us to focus on new issues in our community where we can make a significant impact, all the while still completing all mandated work with 3 tobacco control officers. Specialty vape stores are unique retailers that sell primarily vapor products, such as electronic cigarettes and flavored vape juices. Because these are unique stores and they're allowed to sell flavored vape products, they can be seen as much more appealing to children and to youth. I'd like to highlight here how specialty vape stores in Niagara have increased from 24 in 2021 to 64 in 2026, nearly tripling in the last 5 years. This is a growing trend with specialty vape stores, and this is an area that we're focusing on. As with continued economic development in Niagara region, we expect this trend to continue. Another current trend that we're seeing in our community is the increase in our enforcement work related to vaping. Despite tobacco offenses in local high schools showing a decline, we're seeing an increase in tobacco sales to minors while test shopping. Vaping is where we've been seeing a new trend grow. In 2024, we responded to 69 vaping offenses in our local high schools. In 2025, we saw 115 referrals. In addition to seeing vaping concerns rise within high schools, we're also seeing a rise in sales to minors. During our test shopping inspections in 2024, we took legal action on 18 sales. In 2025, we had 47 sales. Complaints from the public are also increasing, adding to the daily demand and workload of our tobacco control officers. The largest challenge we're seeing in Niagara is around the accessibility of vapes and vapor products. There is a steady increase in specialty vape stores, and we're seeing an increase in sales in minors during our test shopping inspections. We're also hearing from superintendents, principals, and parents across Niagara that vaping in high schools is becoming a major problem as a result. And with an increase in public inquiries, complaints, and referrals, our team of tobacco control officers are faced with an increased demand and workload. To address the concerns with vaping, we're conducting additional test shopping inspections at vapor product retailers. We're also providing businesses with annual education material, including age verification stickers and other resources to support them. Our new high school collaboration initiative provides school leaders with clear, actionable steps to prevent and address student vaping, using a balanced approach that includes education, enforcement, and student support. With this focus on customer service, we're proud to be implementing continuous improvement and modernized processes to ensure that value for money is a core component of this program. Innovation is creating efficiencies, and by evaluating regularly and consistently, we're improving program quality and making a difference in our communities.
Thank you very much, Colin. I'm going to ask, are there any questions of the presenter? I see Councillor Olson, please.
Thank you for the presentation, and you indicated that I think there was that you're first in the province in some in one of the phases there you have, and I think it was the digitization of reporting or something. Is that correct?
Yes, through the chair. So what we've been able to do is really speed up and modernize how our enforcement documents, such as our summons, our ticketing information, makes its way to the courts and then back to us. Historically, other enforcement agencies would have to go, wait in front of a justice of the peace, have information documents signed and then returned. We've kind of implemented this brand new process where it's all submitted electronically signed. We get these documents back to us in a much quicker timeline. It saves times for our provincial offenses courts, and it saves time for our team too. So it's a great improvement.
Okay, thank you. And through you, Chair, that's what I'm looking for is that type of service that I guess this would typically be called best practice. I think this is best known practice because you're going to keep going beyond this, aren't you? I imagine. So what's the next step?
Through the chair, I think we've had a great opportunity in the last year and a half since this tobacco program moved over to our division to really rethink how we do our service delivery, how we can find new ways of innovating, using technology to kind of improve processes. And we've implemented a lot already. We're continuing to look at new ways that we can do that because what we're finding is, as this presentation showed, there's a lot of work for our team. And anywhere where we can cut down on some of these administrative tasks or administrative processes to ensure that our tobacco officers are spending more time in the field, more time doing inspections, more time supporting our schools and vice principals, that's where the big value is with our program. So we continue to look at options that way, and it's only really the beginning for our team.
Okay. Thank you, Chair. And through you, Chair, the value of your service is added when you can stop somebody from using a harmful product like this. So I appreciate that. Thank you, Chair.
Thank you, Counselor. Next, I have Counselor Bateman.
Thank you, Chair. Thank you for the presentation. How is this funded?
Yep, through the chair. So this particular program it follows the standard funding process that a lot of our public health and environmental health services follow through, and that's basically the same approach as across our division.
Thank you. And what is that?
It follows the normal funding formula for mandated work under the Ontario Public Health Standards.
Thank you. Could you describe what that is through you, Chair?
We'll have staff address your question. Counselor Bateman.
Through you, Chair. It's Dr. Magani. So as we presented in the past, I can't remember which month we came to council with our funding agreement, but we do get ministry dollars for all of our work that we do under the Ontario Public Health Standards. So this would be part of those standards.
Thank you. So through you, Chair, we have to apply for a grant. And they fund a percentage of that, or they may not. Is that accurate?
So through you, Chair, it's built into the public health budget, which consists of both the ministry funding as well as the local levy.
Thank you. So we're funded, it would be safe to say that we're funded 59%, Chair?
Through you, Chair, I'm not sure the exact funding ratio is at the moment. So whatever that funding ratio is would be applicable to this program as well.
Okay. Thank you. Through you, Chair, I believe, and I was surprised, but I understand it. Harm reduction is always something that public health advocates for, because we want people to live their best lives, but also allow people to make independent choices. And are we still taking the harm reduction approach to this, that smoking or that vaping is, like I'm using air quotes, better than smoking traditional cigarettes?
Through you, Chair, we're not promoting vaping as smoking cessation. That really is up to the medical community to decide on. The evidence is not firm on this piece. What we do in public health is really promote smoking cessation and ways to get through there that are evidence-based, including nicotine replacement therapy that is available, along with other medical treatments that are available as well. So that's what we would be promoting. Enforcement is really a prevention method to try to make sure that those who are most vulnerable for starting an addiction, so our youngest, our youth, we are trying to make sure that tobacco and other products are not getting into their hands, and that includes vape products as well.
Thank you. And through you, Chair, 64 compared to, I think it was 24, you're right, that is almost tripled. Do businesses have to seek permits to sell this type of product, and who is responsible for giving those permits, if that is the case, Chair?
Yep, through the chair. Thank you for the question, Councillor. It's a good one. When it comes to specialty vape stores, which is what that chart shows, there is a registration process that the province puts in place for any retailer that wants to open as a specialty vape store. So again, these are the stores that are allowed to sell that unique flavored vape products, which can be more appealing. They have to complete an annual registration with the Board of Health or with the health unit. So we get that information sent to us usually at the start of the year. We review the package, ensure that everything is in compliance and the forms have been completed the way that they're supposed to be done. And then we conduct our inspection to ensure that they're in compliance. So there's definitely a process to ensure that these are monitored and that they're operating in compliance.
Thank you. Thank you. Through you, Chair, at what point do we say, wow, we have 64? I think that's enough. Is there any sort of regulations on number of residents versus number of vape stores or anything like that?
Yeah, through the chair. Great question again, Councillor. I would say with this one, there's not any existing bylaws or policy work that's been done to really sort of cap or establish what that could be. Some jurisdictions have explored certain regional bylaws to prohibit vape stores opening in proximity to a school or those sort of actions. So that's something that our comprehensive health promotion team, they're currently conducting a situational assessment and reviewing, what upstream approaches or what techniques could be used in the future to kind of help work towards some of these, upstream work to kind of prevent sort of these issues from happening. So it's definitely something that's on our radar, but nothing within Niagara exists to cap or limit how many of these businesses are there or how many are opening.
Okay, thank you. And last question, I'm not sure if you would know this, but if a child is caught vaping at school or in school, what is the process? Do the school administrators take the vape, or what do they do at that point?
Yeah, so through the chair, great question. So this part speaks to, in the presentation, sort of the new school collaborative work that we've tried to really put in place last year. I met with all of the superintendents for our local school boards and the French board, as well as our principals and vice principals, to really kind of help them understand how we can help as sort of a multi-pronged approach. So what we did at the start of the school year last year was we attended on site for a meeting and an inspection with a tobacco control officer and one of our public health nurses to provide them with all the information and education that they need, resources for students and staff, as well as parents, rules around enforcement and how we can support that piece as tobacco control officers, and how to access vaping and smoking cessation information. So when it comes to a student who is caught vaping, it is a prohibited place to vape or smoke under the Smoke-Free Ontario Act in a high school. So we work collaboratively. The principal or vice principal completes a submission form online to us. We receive that and we reach out to them to determine what steps are appropriate when we're having the conversation with the student. So generally a tobacco control officer will go on site. They'll meet with the principal or vice principal as well as the student, and we'll be issuing either an educational conversation to the student, perhaps a written warning to the student, perhaps a ticket, or if it's a further case where it's escalated and the school board thinks it's appropriate, we'll issue a summons to court where the evidence is provided and the justice of the peace determines if there should be a financial penalty or not. So it's a very progressive approach that starts with education and support, and a lot of schools are asking us to use those enforcement tools that we have available to help get things under control in their school, and in some case maybe send a bit of a message to some of the worst offenders that are there. So we work very closely with them, and a lot of the work that we've done last year was a big success for that.
Thank you. Very thorough answer. I really appreciate that. So one last question back to costs, Chair. Is this something that when we're going through our audit to see about what services we provide to the community, when we're looking at public health, this would be one that we're not mandated to do by the province, and one that or is it one that we are mandated to do, but they don't meet us with 100% of the cost and or even 75%?
Through you, Chair, I'll take that one, Councillor Bateman. So it is mandated, as I mentioned, what we're doing is mandated under the Ontario Public Health Standards. The way that we deliver our services may look different from health unit to health unit, depending on the demand and the needs of the population. So that is what Colin was referring to in terms of the comprehensive health promotion situational assessment that we're doing, is trying to understand in Niagara, for Niagara's population, what might work to further prevent these situations from occurring. And so that would be built into our mandated work. So hopefully that's helpful.
Okay.
And as
Yeah, thank you.
Go ahead, please.
No, I'm sorry, I just was thanking you.
Yeah, thanks.
No other questions. Thank you, Colin. Thank you, Doctor.
Thank you, Councillor Bateman. Next, I have Councillor Encina.
Thank you, Chair. My questions have been answered.
Thank you. Next, I have Councillor Whaling.
Thank you, Madam Chair. Thank you, Colin, for your presentations. Appreciate it. Well, one quick question. I don't know whether you can answer this question or whether our medical physician can tell us. We know the harm of that tobacco has on our systems over the years because it's been around for so much longer. what is the implications of the vaping? Is it comparable to tobacco use, or is it different?
Thank you for that question, and through you, Chair. So we know with vaping, it's hard to control what's in the vape. Vapes can contain carcinogens, so it is not completely harmless. And so that evidence has been growing as the vaping industry is taken off. So we do know that it's not completely harmless. We just don't have as much long-term data on it.
And through the
So it's
chair,
relatively new, so we don't know the outcome as of yet.
yeah, and just to add to through the chair, like a lot of what we see now is we know that vaping can pose the risk because it can lead to nicotine addiction. A lot of these vapor products have a very, very, very high nicotine concentration in them. For example, the requirement in Canada is the maximum requirement in Canada is 20 milligrams per milliliter. Sometimes during our inspections, we find products that are 50 milligrams per milliliter. So these contraband products are making their ways into these corner stores, into these retailers. Our team's finding them, and the addiction piece that's really involved here, especially with the youth and their developing brains at that high school level, like that's where there becomes a really big impact and concern, and that's where we're seeing these products and how we're trying to help find them during our inspections.
So, Colin, with that heavy concentration, could it be more harmful than tobacco use?
Well, definitely more addicting, sorry, through the chair. That can play a big role in why we're seeing a lot of our youth and a lot of children, start these products and find it challenging to quit, for sure, which is why we've built this in those visits with the public health nurses, so that the principals who are there and they're seeing students doing this for the first time, they're having all the tools that they can to try to help support these students who are going through it.
Thank you for that. Thank you, Madam Chair.
Thank you, Counselor. Thank you very much. Colin, thank you very much for your presentation, and maybe this is a conversation we might have at AMO with some of our ministers. Thank you. I don't think I have to have a... Oh, that's, all right, and 4.2 is our Nurse Family Partnership Program. I'll call on Angela Roy, Manager of Early Years, for the presentation respecting Nurse Family Partnership Program. Hi, Angela, go ahead whenever you're ready.
Thank you. Thank you so much for the opportunity to be here this afternoon. I had the pleasure of appearing before this committee last year to share some of the impactful work being done here in Niagara by our NFP team. Today, I'm pleased to provide a brief update on the program, including some highlights from our 2025 outcomes, as well as a short video that highlights the success story of one of our program graduates. So the Nurse Family Partnership Program is an evidence-based nursing-led home visiting initiative that supports individuals under the age of 25 from early on in their pregnancy until their child reaches 2 years of age. These clients are often facing some form of socioeconomic disadvantage. This may include low income, limited social supports, housing or financial instability, or other factors that can negatively affect maternal and child health outcomes. Specially trained public health nurses provide personalized one-on-one support to help clients have a healthy pregnancy, develop parenting skills, and improve health and well-being. The program is designed to support young parents during a critical period in their lives by improving pregnancy outcomes, fostering healthy child development, and helping families achieve greater economic stability. To achieve these goals, nurses invest time and effort into building a strong therapeutic relationship with clients. This approach recognizes that the client is the expert of their life, and they are best positioned to define their goals and priorities. The relationship-based approach continues to produce meaningful results for families across Niagara. Since our program launched in 2018, we've received over 378 referrals and successfully enrolled 292 young parents into our program. In 2025, our team completed over 1,000 client encounters, with the majority taking place in person. Given the intensive nature of home visiting, this level of engagement reflects a strong commitment from our clients as they work towards their goals, and build a brighter future for themselves and their children. As of the end of 2025, 237 babies had been born to families enrolled in our program, and we're also proud to have celebrated more than 110 graduates to date. These indicators reflect more than just numbers. They represent meaningful relationships, healthier beginnings for children, and stronger outcomes for families across the region. While these outcomes help to illustrate the reach and success of the program, the true impact of NFP is really best understood through the stories of the families that we serve. The video I'm going to share with you this afternoon gives you a glimpse into how this program can be life-changing in helping individuals reach their goals. In 2021, Cassandra joined our program as a young first-time parent. With the support of her nurse, she worked towards her goals and gained confidence and built a stronger future for herself and her son. During her time in our program, Cassandra often spoke about her goal of one day being a part of our team. Does someone play the video? Perfect. The Nurse Family Partnership Program is a free, evidence-based home visiting program where young first-time parents are connected with a public health nurse during their pregnancy, and that nurse will support them all the way through until their child turns 2 years of age. Families are given the tools and the strategies to succeed and be the absolute best they can be. We know that change through this program can be generational, and it's going to impact that family for years and years to come. I think what makes NFP unique is the power of the relationship. Pregnancy is a major motivator for change, and it's a way that we can help guide clients to meet their goals.
When I joined the NFP program, my life was pretty chaotic. The future was kind of unknown, what it would look like for me and my son. The support that I needed the most was someone who could show up for me consistently and bring a non-judgmental attitude. My nurse, Ellen, motivated me to be a better person and be the best mother that I could be. And it was such a great experience for me and my son. When NFP was ending for me and my 2 years, I told Ellen that I wanted to be a part of the team. I wanted to work with her, and she encouraged me and told me that I could do it, and that was exactly what I needed. To a new parent joining today, that you can do anything that you put your mind to, and you can be the best parent, and NFP will help you build a healthy future for you and your family. Cassandra's story is a powerful example of the lasting impact that investments like NFP can have. I'd like to take a moment to thank Cassandra for generously sharing her story and participating in this video along with her nurse, Ellen. Today, Cassandra is one of our dedicated nurses on our team, helping to support other families through their own journeys. We're proud to share her story as it beautifully demonstrates how this unique program not only transforms the lives of families, but also helps to create lasting opportunities for growth and success. As we look ahead to the remainder of this year, we are exploring opportunities to expand our eligibility so that we can support even more young families across Niagara, as well as enhancing our promotional efforts to ensure timely referrals from primary care and community partners. Every family's success story reinforces the value of this program and the importance of investing in early support. Thank you for your time today, and I'm happy to answer any questions that you might have.
Thank you, Angela. I'll see if anyone has any questions. Councillor Easton. Oh, sorry, I got Councillor Olson. Sorry, Councillor Olson was first, I'm sorry. Okay. Okay, I think there's something wrong because he didn't hit the button, so maybe we'll go to Councillor Easton. Councillor Olson didn't. Okay, Councillor Easton,
I'm
go
quite
ahead.
happy for council. I'm quite happy to have Councillor Olson go ahead.
Okay, Chair, thank you.
Madam Clerk. Madam Clerk,
Yes.
I'm quite happy to have Councillor Olson go ahead.
Okay, Councillor Olson, go ahead, please.
I'll be short. Thank you. Thank you for the presentation. As somebody who has probably lived most of his life, it's nice to see these kinds of programs going on for the future generations, because I think you get to a certain point in life and you're renting everything and you're living every day for the best and you're living every day for the future. future generations, so I appreciate your work. And I hope you can expand this to other people because this is so beneficial. Thank you, Chair.
Thank you for your question. Next is Councillor Easton.
Oh, thank you very much, Madam Chair. I love this program. When I first heard about it a few years ago, I really thought that this was going to have really lifelong impacts on the individuals that were part of it. I have two questions. The first one is it possible for the mother to introduce other people, maybe other people in her family, but it doesn't matter who it is, a person of her choice? Can they be involved? I thought about this when you were speaking about the multi-generational impact that a program like this could have. How does that work if it does?
So through you, Chair, we absolutely support family members or support people in helping the pregnant individual be a part of the program as well as the families. So as long as they're consenting to have that individual take part in the home visits, we're welcoming to have them be a part and to learn alongside the client with the teaching and the education that we do throughout that 2.5-year period.
Okay, well, that's very, I mean, I would have been surprised if you had said no. There's another factor here that I think the public should be aware of. I think that young people who are, subscribing to be nurses should know that this is another branch of nursing. I'd like you to talk a little bit about the qualifications of the staff who provide this service, because it's not mundane by any stretch of the imagination. What could and also the individual, clearly she didn't just become a part of the team because she was dropping into it. So she must have had a background, and I guess the message there is that this is not necessarily a program for people who can't cope, but people who find themselves in a situation where they need different coping skills or just support to get moving forward in a positive way. Can you talk a little bit about that scenario?
Absolutely. So through you, Chair. So the first part of your question, the nurses in our program are all registered nurses, BSCN prepared. And when they come on to NFP, they do go through intensive training for this program. They are specially trained. So there is specialized in-person virtual training that takes place to learn about the NFP program and to be able to support the clients in this 2.5-year journey. Some of that specialized training is around intimate partner violence, how to do danger assessments, healthy growth and development learning. So they are all BSCN prepared nurses, and then they have specialized training when they do come into our program. As for the question around our client in this particular video, who is now a registered nurse and on our team, I'm not going to go into specifics about her specific journey just to respect her privacy, but I will say that anecdotally in our program, we've had several different clients decide to go into healthcare. Sometimes they come to us and they are still in high school and we're helping support them to finish their high school education. Sometimes they are already involved in post-secondary education. Sometimes education is not a priority for them at that time and they have a priority of finding housing or food security for themselves in during their pregnancy and then when their baby is there. So we do support a variety of clients with varying risk, but they do have to meet our eligibility, which is that piece of being under 25 early on in their pregnancy, so ideally under 28 weeks gestation in their pregnancy, so that it allows us to have enough time during pregnancy to really build that strong foundation before baby is born, and then having some type of socioeconomic disadvantage. So that can vary depending on the client's situation.
That's really excellent. This is a wonderful program. It's targeted, and I think it's pretty hard to argue against a program that clearly has a major impact on the determinants of health. Thank you very much, Madam Chair.
Thank you, Councillor. So next I have Councillor Bateman.
Thank you. I'm happy everyone seems to be enjoying this program because I think it's excellent as well. How did this program come about through you, Chair?
So through you, Chair. Back in 2018, the manager at the time in our child health program and our home visiting programs explored opportunities to partner with McMaster as there was some pilot studies happening in Hamilton. This is an evidence-based program that is global, so there's lots of evidence to support it, and there was kind of a grassroots initiative of trying to bring this program to Ontario. So that's initially how it started, and then Niagara became a part of that research pilot study where we started with a very small team. At the beginning, it was a manager and 3 nurses, and we've grown since then. And I'm happy to say across the province, we now have 9 different health units across Ontario that offer this program.
Oh, that's wonderful that we're a part of that. How is this funded? Or do we receive any provincial funding for this program?
So through you, Chair, I remember I was asked this question the last time I was here as well. So very similar to what Colin was speaking, we do receive a portion of our funding through the Ministry of Health, and then we also get supplemented through the tax levy. For this program specifically, that tax levy contribution is about $128,000. The rest is
and the total program. Through you, Chair, what are the total program costs?
total program cost, I don't have that offhand. I can look into that and get back to you with that. But it is a very small program, so it's not a huge budget. But I can get
as they always are, the most impactful. No, this is wonderful. Thank you so much. Chair, I'll just say that this kind of reminds me of work that goes alongside midwifery, which was very helpful to me. And I was definitely not a young mom, so I can imagine how beneficial this program is. So thank you very much. Wanted to make sure I got that in.
Thank you, Councillor Bateman. Next, I have Councillor Rigby.
Thank you, Madam Chair, and I'm very pleased to follow this and learning how my granddaughter is about to produce a baby girl and sometime in September. Then I've just been advised that her sister is having 2 in January, and so we'll be very busy with this. But which leads me to the only reason why I wanted to say something is I have 2 cousins of theirs sitting up there, and I was trying to find out why, how come they know all this. But I think that having learned the work that is going on, it's helping women, young women and men, and older women go through having new babies and being successful, and I think is very important. And so, you know, some people would say, well, why is the region doing that? The reality is we all need to have that kind of work that's done by this region. And so I thank you very much for your information.
Thank you. Thank you, Councillor Rigby. With no other questions, I want to thank you, Angela. Thank you so much. Okay, moving on to delegations, 5.1. We have a motion there, Community Safety and Shelter Operations Plan. I'll call on Jackie Lindahl, St. Catharines Councillor, Ward 1, Meryton, for the delegation to the motion, Community Safety and Shelter Operations Plan, and I will remind the delegate of a 10-minute time limit. This will take you 10 minutes to get here. No, welcome, Jackie.
Thank you. I have to admit that the last time I was in council chambers was when I was doing television coverage for Cogeco. So it's been a while. And congratulations, Councillor Rigby, on your 3 new great-grandchildren. Please, I'm sorry for chewing gum, but last night I discovered when I was talking about this motion, my voice dried up and I sounded awful and nobody could understand me. So, good afternoon, Madam Chair, and thank you for having me. As you know, my name is Jackie Lindell and I represent the Meryton Ward. Meryton is the largest geographical ward in the city of St. Catharines, so the odds of any shelter being moved into this area again were probably better than average. I'm here representing those people and almost 1,000 people who will be directly affected if the proposed maybe shelter kind of sort of rumor is at Bunting and Dunkirk. Some of those people are behind me today, and they're hoping to get good news, I guess. I also want to thank Mayor Cisco for his help in drafting this motion that was presented to St. Catharines City Council last night and passed unanimously. It first and foremost takes the lessons we learned as the host of the Riordan Street Shelter and creates meaningful suggestions that help those who are most vulnerable first and foremost. It's important that we don't lose sight of the people who are suffering from mental health issues, addiction, and those who find themselves unhoused. Making sure that people are treated with care and compassion should always be our main goal. This motion does that by directing supports directly, making sure that they have ready and reliable access, creates better community partnerships with those that are most involved, and makes sure that they have a safe and secure place to live. It provides security for those who want to change, need help and guidance to change, and are able to transition into bridge housing. The Riordan Street model did not allow this. What security they had was erased at the start of each new day. This proposed area was the reason for this motion, but also because it's about time that we put together a strategic plan for homelessness in St. Catharines. The Riordan Street Shelter was always supposed to be temporary. There was supposed to be a strategic plan for the homelessness, mental health, and addiction support, but we seem to be scrambling as the lease ends. Trying to find the easiest place to put this, government land that might be a way to bypass our public space bylaw, and perception becomes reality. The property on Bunting Road has to be one of the worst places for this shelter. The people who need it are so far away from supports that it's heartbreaking to think of them walking 35 minutes to start me up Niagara on a day like today to get help, or 25 minutes for food at the Knights of Columbus. They are being removed from their community, from people they feel safe with who have helped them through their days, from areas that they know where they can find what they need. Instead, there's nothing there for them. They're being placed in the middle of a construction zone. The twinning of the Skyway is happening across the street. Loud construction will be the norm for these people for the next 5 to 10 years. Some of them may be suffering from sensory overload and perceptions. Bunting Road has transport trucks, something the Riordan Street Shelter does not have, who can't stop on a dime if someone wanders across the road at Bunting or Eastchester. We are moving chess pieces around a board, and these are people. If this is because it's the cheapest option after 4 years, then that's also something that we shouldn't accept. You can't put a price on a person's life. But we also have to be mindful of the community they will be joining, making sure residents feel supported and heard. Partnerships like this don't make sense if the community isn't understanding any of the reasons for the shelter to be there. They've heard stories of what's happened in downtown St. Catharines, and anyone who claims that they are in the worst case scenarios aren't paying attention. They're daily. They see shuttered businesses in the downtown core, and this motion creates a partnership at any suggested or existing shelter in the future with people around them. It gives them access to the people in the region who are able to give them answers and help right away. There's nothing worse than calling your ward councillor who is powerless to help them because the region is where they need to go and you don't know if they're going to get an answer. It sounds like as councillors we're just passing the buck, especially if they can't get help. We're lucky so far in Meryton with our Niagara Regional Police response, and they've been very helpful for us, and I'm glad that we're including them in this motion. I was having a discussion last night at council, and I was talking about transparency, the need to share information. It was said, and correctly, that wherever you put a shelter, and we know it has to go somewhere, that people are going to be in opposition. But the disconnect with this proposed maybe shelter suggestion, the lack of information, the lack of transparency, is not something we should accept. People want to be heard. by their ward councillor, by their council, by their mayor, by their regional councillors, at least for the next 3 months, and by you, this committee. But this decision and discussion seems to have happened in a little bit of a vacuum from every ward councillor, and the city shouldn't hear about it from a Facebook post. They want to tell you about the park that is in the hub of their area, where kids play, families meet, dogs are walked, baseball leagues are on the diamond every day. They want to tell you about how there's a 103-year-old resident who is living in the same house he's always lived on. The family who bought their house from their parents and are still there. The couple who looked everywhere for the perfect place to raise their family. They want to tell you that they're afraid that this is going to turn into downtown St. Catharines if this motion isn't passed. The businesses that are going to be beside the shelter are already experiencing some theft and are afraid it's going to be worse. Owners of the plaza worry that they will end up with stores that are shuttered because a business doesn't want to deal with feces on their doorstep daily. Mom and pop places don't have the money to keep up. They're just making a living, and they won't be able to survive any other costs for safety measures they don't need. One business is trying to sell their land. It's their entire retirement after a life of hard work. The auto repair shop won't be able to keep cars in their lots overnight, and they're going to have to make costly repairs and fencing so they can work first thing in the morning. They should have had the chance to tell you these stories. They would have felt heard, and that's what people want, to let them know they are making decisions and they know what this will do, to maybe get a reassurance that this motion in its entirety will be implemented and they'll feel safer. The "we put the shelter there and then it's too late" perception is why people feel like they don't matter to their elected officials and they're just paying taxes to be taken advantage of. Everyone has a right to be heard. Their feelings and lives become validated. I know at council we always hear our residents. We may vote against what they want, but they go away feeling as if they've had the chance to participate and be heard. And we're able to tell you how they want an issue to go. And then they move forward with staff, with council, with the community. This is what should have happened here. I hope you will vote to adopt this motion. I hope you see that our city staff, council, and mayor have all done our due diligence, care, and concern, that you can see that these hard-learned lessons should be applied and implemented. Thank you.
Thank you, Jackie. I'll ask if there's any questions. Councillor Encina.
Thank you, Chair, and thank you for this. Has the city explored different areas and said, okay, we have to deal with this? Has the city come up and said, we would pick this area over this area over this area? Has anyone in the city done that?
Are you suggesting that the city is supposed to?
No, I'm asking, has the city suggested potential sites?
I think that you would have to ask Mayor Cisco that. That's not something that's been discussed with council.
All right. And I take it then well, I will ask him. That's good.
Thank you.
Thank you. Thank you, Chair.
Thank you. Next, I have Councillor Bateman.
Thank you, Chair. Are we able to get an answer from the mayor about Councillor Encina's question?
I'm
Okay,
sorry,
well,
can you
then I
repeat
will-
that?
Okay, if you're actually pulling your name from there, I'll go to Councillor Mayor Cisco.
Councillor Mayor Cisco, I love adding the title. Thank you, Chair. Yeah, so I appreciate the question, and I can provide a little bit of insight. A city staff did present a number of different properties. I will say I was not a part of this. This was staff-to-staff communication. But I believe the last time it was mentioned, it was well over 90, maybe over 100 different properties in the city that city staff presented to the region as possibilities. But I will also say it's entirely possible some of those were not zoned appropriately. Other issues may have been identified. I just know that was the number that was given to me when I asked.
Thank you, Mayor Cisco, Mayor Councillor Cisco. I will follow up with staff, regional staff about that when the time is appropriate. Thank you for coming today, Councillor Lindell. I am sorry that I am not there in person to see you and see members who have shown up today. Please do let them all know that I am getting their emails. And through you, Chair, to Councillor Lindell, prior to this motion being drafted, did you speak with anyone at the region or the mayor on behalf to confirm that this information was correct?
I found out about it from residents who emailed and called me insanely right after the Facebook post was made. I emailed our CAO and our mayor and asked them if this was an actual possibility, if they had heard anything. Mayor Cisco and I discussed after he spoke with somebody that doing a motion like this would probably be in the best interest, no matter where this shelter ends up or no matter what shelter it is, and to maybe put it with existing shelters like the Southridge shelter on Glendale. But obviously the Facebook post said this was where it's going. It just apparently has not been confirmed and there has not been an announcement made, so I can't say for sure if it's going there or not.
Thank you. And just to be clear through you, Chair, that was a resident's Facebook page. That was not anything regional.
I have no idea who the person was. It was on the St. Catharines Community Facebook page.
Right. Okay, yeah, so it's a community page. Okay, there are a couple of concerns that I in reading your motion, and I will say that I know you through your work as a counselor and in the community. And I am going to second your motion because I do think it's well thought out, and I appreciate the residents who were there today. I think it's well informed. My question to you, did you speak within your motion, you speak to schools, be concerned about this location? And I'm wondering if you had any discussions with the school board or boards, and where that part of the motion came from.
As a former teacher, I can tell you it's incredibly difficult to get hold of anybody at a school or school board in the middle of summertime. So trying to find somebody on short notice was not possible. I can tell you as a high school teacher from downtown Hamilton in the East End that we had serious problems. Kids would wedge doors open so that if they went out to the field, if they went out to play, or their friends were coming in, or they were texting each other, they could let them in, and we had people come in through those open doors. We would find people sleeping in our football field. We would find people just sitting. We had a beautiful stairway going up the top of the front of the stairs, our school, and people would sit there nonstop all day, eating, smoking, leaving garbage. So that's my only.
So thank you. You believe these people were unhoused?
I know they were unhoused. Yeah, we would have to call people in to.
Okay, thank you. And my last question for you, your motion is again very well thought out, lengthy. Have you looked at all the recommendations that you are asking for? Are those? Have you asked staff at all, or have you spoken with the mayor as a regional councillor about what we do at the shelter and what changes you are asking for to come from Riordan to the next shelter? I know you and I have talked a little bit, but not specifically in those details.
Yeah, thank you. The mayor and I talked about the motion. I wrote some of it, and then we also talked to our city staff who have been documenting this particular situation and the challenges that the city is facing with Riordan Street, the complaints they've had, talks with Niagara Regional Police, talks with Quest and Start Me Up Niagara and Community Care, Community Living and the different places on Queenston Street. So we have had a lot of input based on what happened at Riordan and what shouldn't happen in the future. And that way we can at least attempt to make a shelter somewhere that people don't fear. If it was a 24-hour shelter, I'm pretty sure that a lot of these things may not actually apply that happened at Riordan. So that's one thing that should seriously be considered.
Okay. I don't have any other questions, Councillor. Thank you for coming here today and for representing all of our residents.
Thank you, Councillor. Next, I have Councillor Olson.
Yes, thank you, Councillor, for your presentation. Appreciate it very much. I watched the proceedings last night of the St. Catharines Council, knowing that this was coming up.
Then you must be tired.
It was a little late. I think I was on my second bag of chips by that time, so.
I know I was on my third Diet Coke.
Yeah. No, but I appreciate very much the remarks I heard from your residents and yourself, and I see a few familiar faces here in the room with us today. And of course, the mayor, he spoke to the issue. And I was left with the impression that this was a constructive way of approaching a situation. That's what I felt about it after I heard everybody speak, and the mayor speak, of course. And so, is that what the intention was, to come up with a generic form of way we deal with housing like this, or was that an accidental result, or maybe it's a beneficial accidental result? I don't know what it was, but I left feeling like this was a constructive approach to the homeless shelters.
That is exactly what we were hoping for, because obviously there is no confirmed location of where the shelter is going to be moving to. So we thought at this time, since it's going to be discussed, it may be announced, wherever it goes. Like I said, it's going to go somewhere, and we all know that. Wherever it goes, there has to be this balanced approach. There has to be a community approach. There has to be conversations with both the community and the people who help these people, and that their supports are there so that they can move forward. Whether it's from the shelter to bridge housing and beyond, or whether they, can start going into maybe regional co-op housing or whatever happens beyond that. That's what we were hoping for, that this could apply to any shelter, anywhere in the region, actually, if they wanted to take that forward as well, because I think it gives everybody something.
Yeah. Yes, I believe that's, then I was not mistaken.
No, you were not.
It's okay. Thank you, Counselor.
Thank you, Councilor Olson. Seeing no other speakers, I want to thank you very much.
Thank you,
Councilor.
Chair. Thank you, Council.
Okay. Moving on to 6.1, COM 14 2026, Social Assistance Contract Extension Approval for 2045162, Ontario Limited, acting as Clark Marketing Communications. Is there a mover and seconder for item 6.1, COM 14 2026? Councillor Seaborn? Okay, Councillor Height, thank you so much. Any discussion? Councillor Olson.
I was read through this, and am I correct in thinking this is the extension of a program that, and something that's written for our dealing with financial matters within our system? And I'm also wondering whether when it talks about all the services that are on here available to financial services, does this include any kind of privacy concerns about garnishments and things like that? Is there any consideration about that? Is that a vehicle for that kind of thing?
I'll ask Commissioner Conning to respond.
Through the chair. So in terms of this first question, this is a program that supports social assistance in terms of making use of all of the data that's in the BEN system. So we've brought to council information reports that share how important it is to review the data that we have to make decisions based on that data, and this program allows us to do that. There are significant safeguards in place to ensure that there are no privacy considerations, both from a general privacy perspective as well as work that we've done through IT.
Okay. Thank you, Chair.
Thank you very much, Councillor. Next, I have Councillor Bateman.
Thank you, Chair. Through you to the staff as well. Can you just give us a quick sum of what Clark Marketing does for the region? This is a lot of money, and I understand the importance of working within these systems. I used to work within one as well. But I worry that this one company would just, if we just keep going to them, there's a vulnerability that we're potentially being overcharged, like using perhaps the same mechanic all the time, right? You get quotes from everybody else. So can you just speak to that, please? That's my only question, Chair.
Sure. Go ahead.
Thank you for the question, Councillor Bateman. In terms of more detailed examples, I'll pass it on to Director Watson to provide you with some of that detailed information.
Through you, Madam Chair, and thank you for the question. The platform is a specialized solution that supports the Ontario Works delivery that's actually used by 15 other Ontario Works offices across the province. And Niagara benefits from the participation in that shared municipal development model role that supports the common planning and standardized processes. To give you an example of what it yields would be self-service options for elements of the delivery of social assistance that creates consistency across the province that helps with the delivery of those services.
Councillor Bateman? Oh, good. Great. Okay, then I see no other speakers. I will then call the question. I'll ask you to vote electronically, please. We are on 6.1.
6.1 of
The extension of the contract, Councillor. Okay, we are in the process. Well, Councillor, I've called the vote. Okay, we can move on. So we have, that has passed. Okay, moving on to 6.2. 6.2. COM 16, 2026, Early Years and Child Care Expansion Update.
Sorry, then we're back, I'm sitting back, related to proposal to provide facilities in downtown St. Catharines. And I'm not sure where we're finding, what wording we're supposed to be using.
Well, Councillor.
He's confused. He thinks.
So the one thing is 6.6.
Well, we're not there, Councillor, we're not there yet.
Safety and shelter operations plan, period.
We're not, we're at 6.2. We're at 6.2. Okay, let's carry on now. I'm actually asked if there's anyone that wants to, or I need a mover and a seconder for 6.2. Did I get a mover and a seconder?
No, you didn't.
Super. And Councillor Olson, thank you so much. All right, any questions to 6.2? Okay, seeing no questions, I will ask you call the question and please vote electronically. Okay, that has passed. Moving on to 6.3, COM 12, 2026, approval of community services program audits. Is there a mover and a seconder for this item? Can I have Councillor Sorrento and Councillor Sorrento, would you move that? And Councillor.
Happy to do so, Chair. Thank you so much.
Thank you so much. And Councillor Whittabine, thank you so much. Is there any discussion? Councillor Olson.
I had a question about the process here. It says that this is going to be forwarded to the audit committee for information.
Just my feet.
I'm wondering why it would be forwarded, not go to the audit committee before this and then come to this council after the audit committee has had a chance to review it and approve it.
That's a good question, Council. I'll ask staff. Go ahead.
Okay. Through the chair, it is actually in the key facts, the last bullet. So there is a different process for the consolidated audit financial statements versus the community services and public health audits. So for the consolidated financial statements, the audit plan and financial statements do go to audit committee and then are referred to council. The process is a bit different for community services and public health programs, whereby the financial statements are approved by committee, recognizing the expertise at this table, and then referred to council for information as per policy.
So Chair, this is a process that imposed by the province, I guess.
Through the chair, no, that is a council approved policy.
Oh, okay. Then my second question, Chair, through you, is in Appendix 2 on, and I guess it's page 4 on the document here. This is the revenue and expenditure side, and the balance on both years is 0, which leads me to wonder, we have sub-project costs, and then we have program management and administration. Is that contain items that we spend or not recover or fail to recover and fund from the tax dollars, or is that a combination of both things?
To staff.
And I'm thinking of the dollar sign, the quantum is 701,135, described as program management and administration.
Through you, Chair, this particular set of financial statements that you're looking at is our Homelessness Reaching Home program. And so within that, we are allowed to use a portion of the funding towards administration. So that is an opportunity for us to put some of our training costs and staffing costs that otherwise would be covered by the levy. So we're taking advantage of that opportunity from the federal government to cover some of our administration.
So in other words, we build up our costs, or fatten up our costs so the balance is 0. Is that what we're saying?
The fortunate, through you, Chair, sorry.
Maybe an unfortunate choice of words, maybe.
Through you, Chair, I think one of the opportunities that this council has provided to us around funding, whether it's provincial or federal, is we have levy contribution to all of our direct programs, whether it's a Housing First program or shelter costs. All of those are eligible expenditures under either the provincial or the federal funding bucket. So we optimize our upper tier funding before we attach ourselves to the levy.
Okay. Okay, thank you. And so is there ever a report that shows how much this is, what the deficiencies are in the funding sources for programs we must take on?
So through the chair, this is not then just specific to this particular set of statements. It's a broader question, so I'm going to let Beth answer.
Okay.
Through the chair, we did do a report as part of the 2025 budget process where we did outline each of our program areas, what our external funding was and what our levy contributions are. I would suspect that this will likely be an outcome of the core service review, so staff do not have it on their radar to do a fulsome analysis and review at this time, but I'm more than happy to share the previous report that was done in the 2025 budget if
Okay, thank you, Chair. As long as we see that as part of the full service review, that would be fine. Thank you.
Thank you, Councillor. Seeing no other questions, I will I'll call the vote, and please vote electronically. Okay, and that has passed. Moving on to 6.4, PhD 6 2020 26, approval of public health and emergency services program audits. Is there a mover and a seconder? I have Councillor Whalen and
So
Councillor
moved, Madam
Easton.
Chair.
Thank you. Councillor Easton, second it. Thank you. Any discussions? Okay, seeing none, I will call the question. Please vote electronically. Okay, that has passed. And now moving on to 6.5, COM 17 2026, Councillor Information Request, Winter Weather Response Follow-up. Is there a mover and second for item 6.5, COM 17 2026? Councillor Whittabine, would you second that? Or first make that motion, and then second, Councillor Bateman? Thank you. Any discussion? Councillor Cisco.
Thank you, Chair, and thank you, staff, for bringing forward this report. I will say I won't be able to endorse the staff recommendation of the status quo. The purpose of this was to look specifically for, I believe it's option 2 at a minimum, the overnight seasonal shelter. The situation we ran into this year, with the beds becoming available and then not available depending on the weather, is problematic. And I think it causes confusion and it causes issues in the downtown. And so if council is amenable to defeating this, I will happily put forward option 2, the overnight seasonal shelter option, as the better choice. I will say I was frustrated to read the funding source as being facilitated through cuts of other homelessness programs. I think situations like this are what reserves are created for, taxpayer relief reserve, as a 1-year option while we get to a point where we can put this into the operations budget. But I've said this in the past, I think that this is a fundamental role of this level of government. These shelters are our responsibility, and I don't think operating them the way we have up to this point is appropriate. So again, if council sees fit to defeat the staff recommendation, I will happily put forward option 2 as the preferred option. Thank you, Chair.
Thank you, Councillor. Next, I have Councillor Whittabine.
Yeah, through you, Madam Chair. I wholeheartedly agree with Mayor Cisco on this after reviewing it and setting temperature degrees. And I'm thinking if it's 0 or -1 or 10, a cold evening is a cold evening. And I think this is very important, and it's predictable for those that are out there, to know that there's a place for them to come. They don't have to try to look at the weather station to see what the temperature is, whether there's availability. So I would support Mayor Cisco in bringing option 2 forward and supporting it. So that's my comment. Thank you, Madam Chair.
Thank you, Councillor. Next, Councillor Bateman.
Thank you. Through you, Chair. I will be following Mayor Cisco's lead on this, as he's going to be the next councillor to see this through, or potentially if he puts his name in and continues as mayor. But my question is, it's supposed to be almost 45 degrees today in St. Catharines with the humidex and everything like that. And I'm wondering why just the winter. And somebody asked me that, and truthfully, I didn't have the answer. This is just for winter. Can someone speak to that, please?
Through the chair, I'll ask Director Cousins to speak to the protocol that's been put in place.
Through the chair, firstly, I think the reason you're seeing the winter response in this particular report is it was what was asked of us from Mayor Cisco. But Councillor Bateman, yeah, I recognize the other concern that you were bringing forward. Niagara does have a response for homeless people around heat, but it is largely in partnership with our outreach team. So they go out, visit all encampments, and they have water and other supplies. Unfortunately, the region does not own assets per se that we can use as a cooling center. So our partnerships are with local area municipalities in order to support that cooling center opportunity. I think the other piece that's important around a heat alert is we are very fortunate in Niagara. One of the things that makes it beautiful is we have a lot of green space and other opportunities. So we don't have the same heat dome effect as you might see in a downtown Toronto or a downtown Hamilton.
Okay, thank you for that. Still, it is a concern for me and concern for other residents, and some people who are still housed do not have access to cool spots and air conditioning. So I'll leave it at that. I'm happy to support Mayor Cisco going forward with his recommendation. Haven't seen it yet, and perhaps there'll be a little discussion around that, but I'll speak to that when it's on the floor. Thank you.
Thank you, Councillor. Next, I have Councillor Encina.
Thank you, Chair. Through you, if you're looking at the other options, if I can direct this to the Commissioner, if we look at additional costs, and it's going to come from homelessness because there's only so much in the pot, where's the money going to come from? I'm curious as to what, did we find something somewhere else, or is it we're going to take from Peter to pay Paul?
Staff?
Through the chair, thank you for the question. So as you know, we've been focusing on affordability and looking at how to ensure that we can mitigate increases in taxes as we move forward, and looking at how to ensure that we're working within the budgets that we have available. So we'll be looking at currently the services that we offer within homelessness, and the return on investment of the various programs that we offer. When we look at the different types of service we offer through homelessness services, we support individuals faced with housing loss and eviction prevention services. We focus on emergency shelters, as we've spoken to today. We support street outreach, housing first programs, transitional and bridge housing, permanent supportive housing, coordinated access and by name list systems, as well as partnerships with health, social service, and community organizations. And we roll out the programs that we offer through community partners, through contracts that we offer. So we'll need to have a review of that to see what would be the most appropriate service to reconsider.
Okay, thank you for that. So I keep coming back to what a former councillor has always said. We can ask for the world, but if you're not prepared to pay for it, then where are we? And are we prepared to do that? So if going with the option one as the status quo, we have that covered already, do we not? It's already in the budget. Okay. And if you can remind me from last year, did we not alter the temperature?
Through the chair, we did make an adjustment to ensure that we could provide expanded service at a different temperature.
And how many people were turned away?
Through the chair, we had access across the whole system. So as you'll recall from discussions that we had with PHSSC and council last winter, we have a series of shelters across communities in Niagara, and we do on occasion have individuals who present at shelter and we don't have any capacity left at that shelter. And then we provide transportation to another shelter if they're interested in doing so, and we provide transportation back as well.
Okay. So do you need, through you, Chair, do you need something from us to say, do the same thing that we've done last year? Is that what you need, or do you need this to go through first and be at the discretion of staff to say, as we did last year, when it got to that point, alter the temperature?
So through the chair, I think in consideration of budget pressures, if we choose to allocate, I believe it's 400,000 for this option, 461,000, it means that we would need to pull that from other services. So it's the balance of those, of the prioritization of those services.
So through you, Chair, I guess we're voting on option 1 right now. Is that what I'm understanding?
Yes, that's right.
Okay. Thank you, Chair. Appreciate it. Thank you for the answers.
Thank you, Councillor. Next, I have Acting Chair Height.
Yes, through the staff, is this a mandated service that we are required by the province to do?
Through the chair, we're not mandated to provide the service, but we're mandated to provide support for individuals who are unhoused to help support them to prevent them becoming unhoused and to support them to become rehoused.
So is the follow-up, is the $350,000 required? Is it mandated?
Through the chair, the original budget, the budget for option 1 is approved, and that's part of our existing base budget.
Okay, a follow-up in 2026, that's in our budget. We're looking, if we go to option 2, it will be expanding it. But how much more will we be expanding it? What is the cost in 2026? Because this goes into the 2027 budget, which we haven't been presented and this council will not be approving. So how much more will it be in 2026 to this council, to your budget?
Through the chair, it would be about $200,000 for the remainder of the year.
Okay. And if this is decided today, in 2027, when the new council takes over, if they determine, when we look at the core review, that this isn't important, this is not a mandated service, it could be canceled after they see the core review report in December.
Through the chair, I think the timing of the budget process and the timing of when the need for winter weather support services are really critical. I don't think that alignment would support what you're speaking to.
Okay. My concern is when the 2027 budget comes forward, whenever that's going to be, if they're looking at cutting services, that the core review comes forward saying these are services beyond our mandate, we don't believe we should be offering those services or to that level, then they've got to cut somewhere. And I'm not suggesting this is going to be one of them, but it could be. Anyway, thank you.
Thank you. Thank you, Acting Chair. Seeing no other speakers or questions being asked there, I will call the question.
Recorded vote, Chair.
All right, our councillors are recommending recorded, so I will now ask the clerk to conduct the vote.
Councillor Bateman.
No.
Councillor Easton.
No.
Councillor Foster.
Yes.
Acting Chair Height.
Yes.
Councillor Encina.
Yes.
Councillor Jordan.
No.
Councillor Olson.
Yes.
Councillor Rigby.
Yes.
Councillor Seaborn.
Yes.
Councillor Cisco.
No.
Councillor Sorrento.
No.
Councillor Whalen.
Yes.
Councillor Witteveen.
No.
Co-Chair Kiokio.
Yes.
And Co-Chair Morocco.
Yes.
And that's carried 9-6.
Okay, and that is carried. Moving on to, oops, sorry, I better put my mic on. That's carried if you didn't hear me. Moving on to 6.6, COM-C 2026, the Motion Community Safety and Shelter Operations Plan. I'll call on Councillor Cisco for the motion respecting Community Safety and Shelter Operations Plan and ask if there is a seconder for the motion.
Councillor Bateman is seconding the motion.
Okay, thank you. Any discussions? I see. Okay, Councillor Acting Chair Height?
Through you to staff, as I'm looking at some of the recommendations, if we approve this, what kind of delay will this have, and will we be able to construct, decide where the new location is if we go through everything that I'm reading here as part of this motion? We have to be out by December the 31st because we're leasing land from the city, so we're forced to move out of that location.
Through the chair, so that's correct. We do have the end of the lease for the end of December. A lot of the considerations that are mapped out in the motion are consistent with how we operate the shelter. So they are operated on a 24-hour basis. A lot of the services that are offered through there are captured through this motion. One of the pieces that the team in homelessness spent a lot of time looking at in collaboration with community partners is lessons learned as we've been operating shelters. And when, because we knew at the time that Riordan started that we'd be looking at relocating, taking that time to look at what are best practices, is there a way that this shelter could look a little bit different so we'd have more space to provide people access to stay on site outside, and to provide people access to space where we could provide programming and supports. So this shelter does look different than, say, for example, the Riordan shelter, to the councillor's earlier points in the delegation. The operational pieces would not have an impact on the timing and meeting those deadlines in terms of the shelter. If there was a consideration of not moving forward with the work that's in progress in terms of the siting of the shelter, we would not be able to finish the work that needs to be done to site the shelter in time for the end of December.
So the follow-up would be, if we don't move forward with the recommendation that you and your staff will be bringing forward, I would assume, by council next 2 weeks from now, that we might not have a site for this location for this winter.
So through the chair, I believe in the motion we'd be providing a report and providing a presentation that speaks to a lot of operational type items. We wouldn't be able to do that in 2 weeks. A lot of the items speak to work not that we do independently within homelessness services, but work that we do in collaboration with police and with REACH and with Positive Living and other community partners. So we'd need to take the time to have an opportunity to work together with those partners to pull that response together and then bring that forward, which would be probably early fall, like closer to September, we'd be doing that.
Another follow-up through your staff. How many different locations, and I'm assuming you had help with the city of St. Catharines to look around the entire city to find how many locations that this could possibly go. And regardless of location, nobody wants anything in their backyard that could affect them. So regardless of what area we pick, we're going to upset somebody. And obviously where they are now, the people in that area are also upset. So how many locations were you looking at, and was the city involved? Were the agencies also involved with you?
So through the chair, you're right, it's difficult to do the siting. So we have worked together with community partners and with the city in terms of potential options. The work started closely after Riordan opened, knowing that it was a temporary site and we needed to find something different. We've explored around 190 different sites. I think it might be helpful just to point people to a report that was brought to council in 2024. So after Riordan opened, one of the things that was brought forward to council is a report that mapped out considerations for new homelessness shelter site selection, recognizing that this is a really difficult thing to do. And in that report, it includes some of the shelter site selection considerations that are, so for example, elements related to the Planning Act, land use, servicing, infrastructure, and the site due diligence pieces related to considerations that are important, such as, for example, proximity to transit, things to avoid if possible. So one of the things cited in that report is looking at site-specific costs, looking at risk related to overburdening a neighborhood with many services and other risk factors. So there's a whole process that the team goes through in consideration of the various sites, and based on all of those considerations, of the 190, there are very few sites that are able to meet all those requirements.
So the last question, you've been working on this, you and your staff, for about 1.5 to 2 years to find another location. You're just about ready to make mention, because council isn't formally aware of the site other than what we're reading, if this is a possible site. And you're just about ready to announce a location, and we're now looking at this, but there's a site mentioned. Anyway, I don't want you to answer the question because we haven't been given your information yet formally, so it surprises me that they've picked out a location, and if that's a location that you felt after 1.5 years of working with the agencies and the city, I can't support this motion on the floor.
Thank you. Next, I have Councillor Cisco.
Thank you, Chair. And before I begin the prepared remarks I will just point out that this motion doesn't actually make any mention of reconsidering the location or changing the location. It has nothing to do with that. And I hope that those who've read the motion aren't under a misconception of what the motion is. I'll start by just saying thank you to Councillor Lindell for coming forward today. She and I and Councillor Stevens and staff at City Hall worked very quickly after the Facebook post was put up, trying to address a lot of the concerns. It's not the way we would have wanted this motion necessarily to come forward, but the Facebook post was the first information that was out there, and it was out in the community. I also appreciate the unanimous support that I got from City Council last night to bring this motion here. And I also appreciate co-chairs Kiokio and Morocco for willing to allow this on the agenda. I did actually submit this motion or something very close to it on July 3rd, but there were some procedural concerns. And I just want to say thank you to the co-chairs for letting this go forward. I did want to clarify some comments from earlier. The question was asked about whether city staff had put forward locations. City staff provided properties to consider. City staff did not and would not provide any sort of recommendation. So the list that they provided was a list of properties to consider. I can say that, as discussions have been ongoing, because we have known for a couple of years that Riordan was not the permanent location, that it was going to go to a different site. As the discussions were happening about where a future shelter may go, regional staff did bring forward a couple of locations, and I will admit I was very forceful in my opposition to some of those locations. Some of the locations were not zoned properly, but in those cases, they were also in absolutely untenable locations. Like we were presented with possibilities where a shelter would be put in the middle of a low-density residential neighborhood. But for all that to say, I just wanted to make sure it was clear. City staff never made a recommendation because that's not city staff role. The motion, as it's written, addresses the lessons that have been learned, I would say, over the last 20 years, as the city has navigated hosting shelters in the community. We've learned a lot of lessons over the 20 years. The last 4 years especially have identified gaps that we believe exist. In some cases, we've been able to get changes made to operations at the shelters that exist currently. This motion, I think, creates the expectation that we do things that we know we need to do before and not after the fact. As it's already been said, this is what we'd like to see at all shelters, both in existence now and potential future sites. And with that in mind, there is one addition to the motion that my council made last night. And I believe the clerk has a copy because I know our city staff forwarded the motion last night after the council meeting. But there is one additional be it further resolved clause right after number 17 in the list that says that this list of requirements be applicable to all shelter locations in St. Catharines. And so I'm hoping that additional be it further resolved clause could be added into this motion today. It's my motion, so it's friendly. I would also say if council, if Public Health and Social Services Committee wants to change St. Catharines to Niagara, I'm amenable to that as well if someone wants to make that amendment. This motion creates an opportunity to protect the people who will be living in the shelter and the people who live in the neighborhood. The reality is when we don't implement measures like this, like the ones that are in this motion, we wind up with residents fighting against the shelter proponents. And that's what causes a fight every single time a shelter needs to be located in a community. We've seen it happen in Niagara Falls. We've seen it recently happen on Ontario Road in Welland. It doesn't need to be that way again. We don't have to keep running into this heavy opposition. And Councillor Lindell talked about it. You know, if there had been communication beforehand, people may be, frustrated. I think the reality is everybody seems to push back always when it's located near to where they live, but at least they would have felt heard. It doesn't need to be the same way again. We can be better than that. And if we're proactive about recognizing that there are concerns on both sides of the debate, we need to address them before we move forward with new shelters. I read in the paper yesterday, Commissioner Koenig had some comments. Niagara Region is committed to working collaboratively with our local municipalities, community agencies, and other partners to ensure that Niagara's homelessness response system meets the needs of people experiencing homelessness while supporting safe, healthy, and welcoming communities for everyone. That is exactly what we're asking for. This motion is the result of what would have happened collaboratively with the residents in the neighborhood and staff at City Hall who deal with these issues on a daily basis, with the city councilors that receive the concerns and the complaints, if they had been a part of the collaborative efforts. So I hope my colleagues will support this motion. I think if you read through it and you actually read the individual things that we're asking for, none of it is earth-shattering and all of it makes sense. So I would hope that the committee can see fit to support this and that I can gain the support of regional council at the next meeting. Thank you, Chair.
Thank you, Councillor. Next, I have Councillor Encina.
Thank you, Chair. As I went through those, I'm looking at what is it, through you to the Commissioner, what is it that is there that you're not already doing? And as with everything else, there's a cost associated to things. So if you're going to look at these different avenues, if you're going to go out and do looking at different areas and talking to the public, one, it slows the process. Two, it costs money. So I guess what I'm looking at is what kind of dollar value are we going to look at? I know everybody's going to say, well, you can't put a dollar value on it. But unfortunately, in today's day and age, we have to, because something else is going to go astray. That's the way we are right now in the situation we're in. So I'm not sure if you could address that.
So, Councillor, you have two questions. First of all,
sorry about that.
Okay, so we have two questions. So address the first question first.
So through the chair, a lot of the content that's in the motion is consistent with what's in place and speaks to leading practices. One of the things that we will be doing is taking this, making sure that we meet with all of the operators, because as we say, we deliver the work through contracts with organizations who deliver the services, and working with community partners, because a number of elements within the motion are not components that we do directly, but we do, in collaboration with others that we work with, whether it's CORE or REACH or other community programs. We'll need a little bit more time to quantify the financial impact, but I do understand what Mayor Cisco was speaking to in terms of looking at how do we collaborate in terms of ensuring that we're delivering services at a shelter in a way that, we're working together with the surrounding community. And when it is time for us to move forward and, we have information in terms of specifics around the shelter and when it will be opening, There would be an information session that's held with the surrounding neighborhood and an opportunity to establish a community liaison committee to listen to concerns and to provide information and to have that ongoing collaboration when you have a shelter in the neighborhood. And also to provide the opportunity for folks in the community to be able to go for a tour through an open house so they can see the space that's available and how we would offer programming through that space.
Through you, Chair. No disrespect to anyone, but this is done because of a Facebook publication. I don't remember receiving anything from you, Commissioner, with regards to the location. Maybe I missed it. Have I missed something along the way?
Through the chair, there hadn't been a public announcement as yet.
Okay, so this is being looked at through the eyes of Facebook or what someone had put on Facebook. Okay, thank you very much.
Thank you, Councillor. Next, I have Councillor Whaling.
Thank you, Madam Chair. Just a couple of questions. Director Koenig mentioned a cost factor. Should we be concerned about us being lame duck, meaning we have to have the expenses covered by the end of December, which we won't be able to do? Or do we have an idea, ballpark, where the staff will be able to be within their realm to approve any expenses?
Commissioner
with the
Coleman.
move?
So through the chair, in terms of operations at this specific shelter for the remainder of the year, we would be looking at rolling out these requests within the, excuse me, a budget that we have available.
So that being the case, the move, but everything will be covered in the expenses within the realm of staff?
So through the chair, we'd ensure that anything that we roll out is in line with the funds that we have available.
That's great. And just another thing also, when you come back with the report in the fall, Henry, can you give us an idea what's happening up in Welland also? Is that site? Just give an idea if things are going well, not well, or just where we set with that status of that location?
So through the chair, I think that, I think for anyone who lives close to a shelter, I think there are always some challenges associated potentially with that. I think we have to be honest about that. And staff in homelessness services, staff who work at the shelter, work together with the neighborhood to work through those challenges. We have seen some really good impact from the Heart Hub program that's been implemented. So for individuals who are really struggling with addiction issues, mental health related issues, something that's new that we haven't had when we've opened shelters in past is a resource for folks to be able to access services. And with and again, just like the comment that was made around the change to the motion, speaking to offering this across the shelters, we do operate the shelters as a system. So when we introduce something new at one of the shelters, you'll recall some time ago, we expanded our diversion program, for example, then we roll that program out across all of the shelters. So it can be a system-wide enhancement.
That's great. Just one last thing. Can I make a friendly amendment to this motion that we change St. Catharines to Niagara?
That's friendly.
Thank you.
Okay, thank you, Councillor Whaling. Is that all?
Thank you, Madam Chair.
Great, thank you so
That's
much.
great. Thank you.
Councillor Bateman.
Thank you, Chair. I do think this is a little bit unorthodox because we don't have the information as council yet, but I think that reading between the lines that the information is there. I will express a little bit of disappointment that in the way that this has all come about because it is really hard to be a counselor in the sense that you're getting questions about something you have no information on. And that is, seems like a reflection of the work that I'm not doing in the moment. But I will ask for just a little bit of clarification because I don't think that is a criticism of staff. I think that is a decision of council. So could I ask Commissioner Koenig to speak about that? Why is it unfolding in this way? Just so people understand. Is that something that you could speak to, Commissioner Koenig? If not, I understand as well.
Through the chair, in terms of the information that you're referencing related to the Facebook post, I would have been privy to exactly the same information as the general public.
Okay, thank you. I watch this council. First, I am in support. I know that some of this motion may seem like we are heavily policing people who are not unhoused, but after getting many phone calls and seeing and visiting the site and talking to people, I understand why we're in this position and why Councillor Lindell brought this motion with Mayor Cisco and Councillor Stevens as well. I will say that, as somebody who really believes in social services and what they do to support people in our community who are at a much greater disadvantage than I am, we gave the Niagara Regional Police, who have a budget of $236 million, $140,000 last month without even blinking an eye. And when we're talking about people dying in the street to, raise the temperature or build an emergency shelter, we're met with massive amounts of discussion about, what's this going to cost us and how is this getting on the budget? So I do, I'm on my way out of this council, but I think that that's something that this council really needs to think about. Why are we spending money if not to make people's lives better? Right. So I don't, and I'm not going to attempt to change this motion, but I do want to talk a little bit about advocacy. So I, encourage people to call me. And I got on the phone with a lovely person today who has a business in that area. And I think that I hate the fact that we have shelters in our community. I don't think that communities should have shelters. Communities are communities. We should be supporting one another. That being said, I know our world is very difficult, but and there are lots of things at play. But advocacy helps. Calling your MPPs and writing the premier about rent control and about investing in housing that is actually affordable and attainable for people is what we really, really need. I'm an educated person. My partner is an educated person. If we didn't have the family that we have and we didn't buy the house when we bought it, we would not be able to buy a house in Niagara, a place that I grew up in, which is it's outrageous to me. So I know how vulnerable I am and my family is, and I have the supports, and I'm grateful for that. So, I'm sad that we're in this position. I'm sad we don't have a permanent space with services included in it, that people are getting really solid help that they need, that they may not even decide that they need until, sometime in the shelter system. I encourage people to call me, email me with your concerns. I will show up with you. I will talk with you. And I know staff are willing to do that. As a counselor, I'd like to be part of any of those meetings if willing. But I'm happy to second this. I think we should be providing all the supports we can, and we should be funding it to get ourselves out of this position. I do not want to see a community filled with shelters with people who are unhoused, who are in need of health supports. That's not the community that I had hoped for. But I'm happy to second it. I thank you for the work that's gone into it.
Thank you, Councillor Bateman. Next, Councillor Kyokyo.
Thank you, Madam Chair. I tend to agree with Councillor Bateman that I don't want to see a community just full of shelters. I think what we need is housing for our people, and I think that's where it starts, to help the people that are in need. Now, in regards to this motion, I do agree with the motion. I don't think it's just about St. Catharines and where it's being located or suggested it's being located, but what we have here in the whereases and the recommendations, that's what we need if there's a shelter around. I'm from Welland, and yes, we deal with a shelter on Ontario Street, which is by a school, an elementary school, by a park, and by businesses right next door, Plaza, Tim Hortons. It's not pleasant. What we've seen is not what we expected at first. But I think collaborating with the community, the surrounding community, is very important as we move forward. I just think we need to help each other and get it right. You know, if sometimes I say, just blow the system apart. You know, let's start over. Let's start what we really need, and it's, to myself, it's housing, and we work from there. So my one question I did have for Commissioner Koenig was, and I think Councilor Encina asked it, is how's this proposed community safety shelter? What's the difference between what we have now in Welland and in Niagara Falls to what's being recommended here? Just Nicole's.
Through the chair, a lot of the components that are in here are in place. I'll ask Director Cousins to speak to some of the more detailed parts of this.
Through the chair, we have been continuing to evolve our practices. We learn each time we get an opportunity, and there's an experience. I think the opportunity of the region to be in direct operations for a couple of years was also impactful in the policies and what we're doing going forward. So the current practices that we have right now, we do have dedicated phone on site where we can share that phone number with community in case there is an emergency and they're looking for a support. We do have community liaison committees, and we will be distributing that terms of reference at the community information session and providing that opportunity. And of course, we will have that public information session prior to opening. We do have an FAQ document that speaks a lot more about what a housing-focused shelter is. The goal truly is to support an individual in their journey to housing, and it is something I'm proud to say Niagara does a pretty good job of. So far this year, we've housed over 400 individuals out of shelter. CCTV cameras, absolutely. We have lots of them, and we're monitored 24/7. We have 24/7 staffing on site. We do work with Niagara Regional Police for the CEPTED supports that were spoken about here. We do, of course, fund outreach as well, so we can ensure that partnership and support for outreach services beyond the borders of the shelter. And we did design this particular one differently, and we made the common area substantially larger than what is at Royerton and put offices in. So the idea being that we can provide significantly more daytime programming, supports on site, counseling on site, third-party agencies can use offices on site to be able to provide some of those enhanced opportunities for clients. I can't speak to Niagara Regional Police or some of the other garbage-related items that are outside of the scope directly, but from a shelter and a homelessness perspective, we are operationalizing these as we move forward with sites.
Okay, that's good to hear. Thank you.
Thank you, Co-Chair. Next, Councilor Sorrento.
Thank you, Chair. Through you to Commissioner Koenig. You said that there were 190 different sites that were presented to you, and you said that there were only a few that were viable. Do you have that number? Was it 10 that were viable? 4?
Through the chair, so none of the sites met all of the requirements, and I think the mayor spoke to it too. There were a whole host of reasons that sites aren't appropriate. It's really difficult to find these sites, and between planning requirements and zoning requirements and still ensuring there's access to transit and certain distance away from schools, really quite challenging to find locations. And I really appreciate the support that we had throughout. I mean, it started before I started in this role. They'd already been hard at work at trying to find a location. So yeah, really difficult to do. And I think once we're able to move forward with the final location, really working together closely with the community so it can be a supported transition.
And Chair, through you, I'm sorry, Commissioner, did you say that none of those sites were acceptable? Did I hear that correctly?
Through the chair, that's correct.
Okay, thank you. That's very important to know. Through you, Chair, to the Commissioner, before choosing the final location, wherever it will be, did the team consider any other locations prior to the final choice that might have been refused by anybody? or was this just, is the final location the only choice that you made for the potential, shelter?
Through the
If you can answer, if you can't, I'm content to go in camera another day.
I'm not sure I understand the question, but I think if let me know if this answers your question. So, as various options were presented, so we had real estate looking for locations for us, as Mayor Cisco mentioned. We had staff provide, potential sites for consideration, just to say, these might be sites available, but they'd need to go through that roster of considerations that I mentioned. That's mapped out in COM 19. Once
Chair,
we had a site where we were able to meet those requirements, that's where we landed.
Chair, through you, clarification, Commissioner. Did you pick another site before making the final decision, at the final choice?
Sure. Through the chair, I'm going to ask DCAO to speak to that question.
So through the chair, after the 190 properties, and this was done over a series of, over a significant amount of time, so it didn't all happen at once. So the roster of properties would change over time. There were ones that were available that we looked at that were taken out of the running immediately. There was just too many criteria, too many issues. There was a smaller subset that seemed to have some promise, but as the commissioner indicated, they were all eventually eliminated, whether it was through conversations with the city, whether we did some further investigation and the level of contamination, let's say, was not appropriate. So there was a series of reasons why this smaller subset. There was some properties that really did look promising, but at the end of the day, really, it's been a very, very challenging to find an appropriate location.
Okay, so through you, Chair, there was no other site that was considered final prior to the final decision. Chair, through you, a procedural question. Is it typical for staff to consult with the residents and local businesses prior to making the final site choice? So it's a procedural question because the residents were upset, understandably, and business owners. So procedurally, how would that work?
Through the chair.
Would you speak?
Related to siting for homeless shelters, procedurally, it wouldn't be common to do community consultation as part of the selection process.
Okay, and through you, Chair, would you care to elaborate on that, Commissioner? Is that because it would be an in-camera item and the announcement wouldn't be made at that point in time, and you wouldn't want to cause any undue angst among residents and or business owners? Would that be part of the explanation for not consulting with the aforementioned with respect to the final shelter site, wherever it may be?
Yeah, thank you. It's a good question. And I think some of those pieces are considered too in that report that I mentioned, that consideration for new homeless shelter site selections. It's difficult, the siting of that, because I think it would be fair to say that whatever site is selected, the neighbors may not be excited about the shelter being sited there. And because of that process, where we landed was that site selection would look like reviewing a whole host of criteria that would need to be met. And when we went through that process of identifying what those different items should be considered, we did get input from the local area municipalities on that draft report, and from the community partners that we work with, as well as individuals with lived experience throughout the system, just to try to ensure that we were looking at all those contingencies.
Understood. And I quite, through you, Chair, Commissioner, thank you. And I quite agree with you. And Acting Chair Height, as you mentioned before, regardless of where this location is ultimately going to be placed. People are going to be very, very upset. Chair, I only have one more procedural question through you, either to the commissioner or to the director. And before I ask, I'll just say thank you very much for the motion, and thank you very much to Director Cousins and the entire team for all the work that they do with our unhoused people. So here's the question, Chair, through you. If it were to be the will of council to pass a motion, how long would it take to implement the requests and the whereas clauses, and would we be able to meet all of those requests before December?
Through the chair, thank you for the question, and I'll ask Director Cousins to speak to the specifics.
Through the chair, as we work through the motion, we would have to work with our partners that are also part of this motion. Right off the top of my head, of course, it would be ourselves, the city, when you speak of garbage, Niagara Regional Police, when we speak of security, positive living, when we speak of needle cleanup. So we would need to come together and create a fulsome response to the motion. I think the part that we have more confidence in is a significant number of the elements that are operational are things that were either already built into the design or are already planned for the site. So I don't think our ability to respond to the motion would have a direct impact on our ability to proceed with the project.
Understood. Chair, one final question through you to any one of our directors or the commissioners. Is there anything that you would like to say at this point in time to the residents that hasn't been said?
That's a pretty open question. Anyway.
It's an open question, Chair.
Let's see who wants to take that.
Thank you for the opportunity, Councillor Sorrento. I think really just for the neighborhood where there will be the introduction of the shelter, that there would be information that's shared with homes in that vicinity and businesses in that vicinity, so they can be aware that there's an opportunity to join an information session. And for folks who participate in that information session, they can, if they're interested, they can become part of a community liaison committee, so that there's an opportunity to raise concerns if they have any and to get some more information. And as Director Cousins spoke to as well, 24/7 there is a number that you can reach for folks in that neighborhood. So if you have questions, concerns, that you can always reach somebody with questions related to that shelter.
Thank you, and I yield the floor.
Thank you, Councillor. Next, I have Councillor Rigby. Councillor Rigby?
Thank you, Mr. Chair, and just, Madam Chair, sorry. Just the history of certainly St. Catharines and the landing of residential areas and support of people who would have been needed in the past certainly has been there and has been working with many of the same partners you're hearing today that have been working on these areas. And I think the idea, I like that we're looking to open this not just from St. Catharines, but for Niagara, because it's possible that there may be facilities that are far better or better locations that we may be able to find. So I think that this is the direct kind of direction to have the ability to look at other areas. The other, I certainly agree, is that what we're looking at is they will provide areas for schools, for washrooms, for public spaces, all of the areas that are needed. Even though that the city of St. Catharines approaches the improved housing outcomes while minimizing impacts on surrounding neighborhoods through proactive planning and collaboration, and that is the key to how we're going to be able to continue to go ahead and find the areas. I had a chance to read through the motion that was putting forward that came from Councillor Cisco, sorry, and I think that it finds that there's options and there's ways that we can move forward. whether it's in Timbuktu or Niagara Falls or St. Catharines or Welland or wherever, is that we find places for people who are in need of being looked after, and that they may be at the same time build their own forever after in their future. So, Madam Chair, I see that there's some real ways of us going forward from the documents that we do have, that I don't think we've approved or anything, is just that we have them. And there's good work that our staff, all of our staff, have gone forward to make work. And I certainly appreciate that, and I would recommend that we continue to take that motion forward as we go. Thank you, Madam Chair.
Thank you, Counselor. Greatly appreciated. Counselor Seaborn.
Thank you, Madam Chair. I'm satisfied that all my questions have been answered at this point. Thank you.
Thank you, Counselor. Next, Counselor Foster.
Yeah, thank you, Chair. So just a couple of things as we're sort of finishing off this motion. Number one, and I can tell you as a councillor not from St. Catharines, the reality is that I think all of us understand that St. Catharines has had to take on the lion's share of working in the homelessness issue. And I believe all of us have been hugely supportive as we go through this. And so, the good thing about St. Catharines is the fact that the services and the public transit and the various pieces of the puzzle that come into play that are appropriate to at least try and help in a lot of these areas is there, and that's why I think there's an unfair burden that comes into play. There was mention earlier of a friendly amendment to state Niagara instead of St. Catharines in a few differing places. Can I recommend as another friendly that it be distributed to all of the MPs and MPPs in Niagara, as well as all the local area municipalities, because again, we're all in this particular battle together. So I think I think that it would be appropriate. I hope so. That's through to Mayor Cisco.
That is friendly.
Yeah. So just the last thing on my list here, and I think it was addressed a little bit earlier, but I'm concerned about timing things as well. So just through to Commissioner Koenig or to our director as well. So for sure, sort of going back and doing additional processes and stuff like that, we're not going to create havoc for, I guess, whatever that next council is going to be on December the 1st if this doesn't get done. So I'm crossing my fingers that we're not putting unfair burden onto the process itself. So I guess maybe that's through to Commissioner Koenig.
Through the chair, so we'll be taking the motion and doing all of the steps that Director Cousin spoke to, ensuring that we meet with community partners who are going to be impacted, operators who will be impacted, looking at what's in place already, what's the discrepancy in terms of what's in place and what's not, and how do we address that gap, and implement what we're able to implement within our existing budget. And then if through the course of that, because we wouldn't want to presuppose, right, we do need to go through that exercise. If when we complete that work, if there are items that are beyond the budget, then we'd certainly bring that back to council for consideration, so council can provide feedback in terms of their considerations related to budget.
Okay, so through you, Madam Chair, I'm just wondering how soon do you think that's going to get in front of us? And the reason is that we got a really odd set of electoral and budgetary and lame duck scenarios that are coming up. So I'm just curious what you think is going to actually happen with that.
Yeah. So Through the chair, it's a great question, and I don't want to overpromise and underdeliver, recognizing it's halfway through July. But we're working to early fall to be able to have that information pulled together, subject to availability of folks. August is always a little bit tricky with, community partners and what have you on vacation, and we do want to make sure that everybody who is part of this work has an opportunity to be part of that plan that we'll be putting together.
Thank you, Madam Chair.
Thank you, Councillor. Next, Acting Chair Height.
I think Councillor Encina first would be my second time speaking.
I think it'll be his second too, so go ahead.
It's my turn. Could we bring up the information again, please?
The motion?
Well, that's my concern. What we're looking at are whereases, which I don't have a problem with the whereases. I have a problem with the resolution. If we scroll to the bottom of what was part of the resolution is what I have a problem with. Because that's what we're voting on. Which is somewhat different than what I'm reading right now. If you can go to Councillor Encina, I have something in front of me that was dropped off on my desk that I'm reading that's different than what I'm seeing there
Fair enough. Councillor Encina.
as a resolution.
Thank you, Councillor Encina.
Thank you, Chair. I think my issue is that I'm looking at the process. We're dealing with an issue because something was put on Facebook and now it's been thrown in front of us. We haven't had anything come from our staff. We haven't had a report. We haven't had anything to say, this is where we're going to go. This is what we're going to do. So now, personally, I feel we're behind the 8 ball as a councillor because we haven't had that time. We haven't had that opportunity to look at it. What we're going is we're looking at this and we're asking staff questions, okay, but where's that report that we can reflect on? And that's what I'm looking at. So, and all due respect to this, if we're doing most of this and we're looking at this, can we not say this is direction to staff rather than putting this motion through? Can we say that? If we can say, look, we want staff, we would like directions to staff to please follow this kind of thing. And then staff can come back to us with a report saying, hey, this is what we've been able to do. This is what we've been able to come up with. These are your options. At which time we can say, have we done this and have we done everything else? So to me, I realize the amount of work that's gone on into this and then during a short period of time. And that's why I'm saying, let's take a step back. If this can be introduced as direction to staff, staff can bring a report to us with what they have to say in the report along with this. I think we are better informed and we can make an intelligent decision as to what's going to happen next. And I realize there are people here that to see this through, but in order to do that, we have to make the best decision for the people that we all represent. So that's my concern. My concern is that we're jumping ahead of this before we should. And again, when we look at things like this, what are the cost implications? You know, whether I'm here or not next term, I hope I am. But if what we're looking at is what kind of burden are we going to put on to the next council? And again, referring back to the lame duck, do we really want to go down this road? And it's going to hamper what they're doing. So I would just want to say, I am torn. I really am, because I really believe that we need to get a report from our staff, to hear what they have to say, put the numbers down, let us see that before we move ahead. And I think by going from a Facebook post to here, it's like a shotgun approach. Let's blast it everywhere and see what happens and what sticks. That's all. Thank you, Chair.
Thank you. Thank you. Does anybody want to comment back on Councillor Ensign's comments, or we'll just take them as comments? All right, we'll move on to Councillor Acting Chair Height.
Sure, can I see resolution 2 and 3? Resolution 3 is the one that I'm concerned with. If that is the location that staff have and are prepared to get that information out prior to next council meeting, which is July 30th, by making that motion and moving it today, it states not to proceed, and I have a problem with that. If that is the location, and if that's the area that our staff have decided after 190 pieces of property that they've looked at, they can't proceed with this. And I'm not prepared to vote against staff with resolution number 3. So I can support everything but number 3, so I'll be voting no on number 3. If that is the location that staff will be sending us the information prior to the 30th of January or July.
Thank you, Councillor. I guess that I don't have any other speakers. I know this is the motion of Councillor Cisco. And I just wanted to say that it says that they're not proceed. They're not, I believe that Councillor Cisco said, they're not saying they don't want to. They're basically saying they don't want to proceed until they have actually done the community safety and shelter operation plan. I'm hearing that staff is already doing, I mean, listen, now coming from Niagara Falls, we've got a shelter that we've been waiting for over 1.5 to 2 years to try and find land to relocate the one on Summer Street. And I think Welland's doing the same thing. And every situation that's come to us, when those recommendations from those cities came to us saying that they support it, we supported what they supported because that's what that city came to us to support. I think what we're looking and what this motion is asking, that we just do a better job at overseeing the shelters, that there's more input from police, there's more input from bylaw, from different organizations that we're working with. There's more monitoring with the community, with the neighbors, school boards, whatever. I have to honestly tell you that nobody is willing to step up and provide us with any properties to move our shelter on Main Street and Summer Street in Niagara Falls, and I think the same thing goes for Welland. We are at a crisis trying to find a place to put these individuals that are trying to live with dignity. And again, I'll go back to the province because this comes back to that we do not have one highly supportive housing for individuals that are suffering from severe mental health disorder or drug addiction. That's a huge problem because I'll tell you right now, I don't believe in shelters and encampments either because that's not a way that individuals can live with dignity. I believe that this motion is really trying to say that we need to do a better job. Councillor Cisco, correct me if I'm wrong.
No, Chair, you're not wrong at all. And I was going to suggest, I mean, if you want to take out the Bunting Road shelter and replace it with a shelter everywhere in this motion, that's fine. Like this is not about an individual location. Yeah. I'm sorry, Chair. I'm very frustrated with some of the debate that's gone on today and the purposeful misrepresentation that some people have engaged in.
Sorry, I don't mean to get into a back and forth, but I think we've got a situation where we've got a shelter in Riordan that's going to close. We have to find another location. Nobody's coming to the table with any property. Nobody wants to buy a school. Nobody wants to buy anywhere, but it has to go somewhere. And I think that this is basically the last case. So yes, I don't want to talk about just one location. I think this is something that we actually have to put and implement for all shelters. We just have to do a better job until we can find another source. And we need to actually work with the province in trying to make that happen. I'm actually going to say that there's no one else speaking, so I'm actually now going to call the oh, sorry.
Recorded vote, Chair.
I have our CO.
Sorry, through the chair, I just wanted to speak to the questions that were raised about not proceeding. I think the challenge with the timing is what we've all been talking about in terms of it, you know, regional council being lame duck, but City of St. Catharines council being lame duck as well. So the opportunities to present back to both regional council is problematic. We've been talking about it, but also the opportunity to present back to City of St. Catharines becomes problematic given the time frame within which we would need to operationalize the shelter, start operations of the shelter, transfer everything from the existing site, and then decommission that site all before the end of the year. So it's not that there isn't, I think you've heard the willingness from staff to absolutely work on the framework that's been put out here. It's much more than a framework, sorry. The items that have been put here in terms of, you know, the operational needs of the shelter, the performance measures, the public reporting, all of those things. There's definitely a willingness to build on all the good work that staff are already doing and the best practices that we're learning about. But I do think that this could be challenging in terms of not occupying any shelter before the end of the year, given the challenges of when everyone goes lame duck, and then the election, and then when they have their inaugural meetings. We would need to operationalize that early fall. And I just don't know that there's just a timing issue that I wanted to flag for everyone associated with that.
I'm calling the motion. I'm calling the question.
Chair, can we vote on number 3 separately, please?
Is that a question I have to ask for Mayor Cisco? Can we pull that separate?
In the words of our former chair, it is always appropriate to ask for things to be separated.
Okay, thank you. So we'll vote on number 3 separate. Are we going to vote on the whole first?
No, we'll do number 3.
Number 3 first. So we're going to vote on number 3 first. Okay, I'm going to call the question. Then I asked that somebody said recorded. Are we doing it recorded?
Yes.
All right,
Recorded, please.
Clerk?
Okay, Councillor Bateman.
Support.
Councillor Foster.
Support.
Acting Regional Chair Height.
No.
Councillor Encina.
No.
Councillor Jordan.
Support.
Councillor Olson.
Support.
Councillor Rigby.
What are we doing?
We're voting on recommendation 3 of the motion that's up on the screen.
Do you agree or disagree with that?
Yeah?
Is
What's the matter?
Yes.
Councillor Seaborn.
No.
Councillor Cisco.
Yes.
Councillor Sorrento.
Yes.
Councillor Whalen.
No.
Councillor Woodavine.
Support.
Co-Chair Kiokio.
In favor.
And Co-Chair Morocco.
In favor.
9, 10. So that's carried 10-4.
Okay, then I will call the question to vote on the remainder of the motion. Is that a recorded vote as well?
Yes.
Okay, clerk, please proceed.
Councillor Bateman.
Support.
Councillor Foster.
Support.
Acting Regional Chair Height. Councillor Encina.
Support.
Councillor Jordan.
I'm in favor.
Councillor Olson.
Support.
Councillor Rigby. So we're voting on the rest of the motion. We already voted on 3. We're voting on the remainder of the motion.
Councillor Rigby, you support or against?
What? I can't hear it.
You support the rest of the motion.
Yes, I do.
Thank you.
Councillor Seaborn.
Support.
Councillor Cisco.
Support.
Councillor Sorrento.
In favor.
Councillor Whalen.
Support.
Councillor Woodavine.
Support.
Co-Chair Keokeo
In favor.
and Co-Chair Morocco.
Support.
That's carried unanimously.
Okay, that is carried. Moving on to consent items. Does any member wish to vote on any of the consent items separately? All right. Is there a mover and second to take oh,
Chair.
sorry. Okay. I'm sorry. I didn't see you there. Councillor
Yeah,
Sorrento.
yeah, my bad. Chair, can we just pull 7.3, COM 15, Seniors Quality Report? I just want to speak to it very, very quickly, if you don't mind, please. I'll be very quick.
Okay, we'll speak to it now.
Okay, yes.
Okay.
Just as a point of order, though, does the councillor want to vote on it separately?
No. Through you, Chair.
Oh.
No. I just want to speak to it with the permission of the chair.
Okay, so I'll put the block on the floor and we will call. I need a mover and seconder. Councillor Foster.
I'll move.
And Councillor Whalen. Thank you so much. All right.
Okay, thank you, Chair. Through you to Commissioner Koning. Could you just tell us what the Obi robotic arm is in dining assistant? It's pretty interesting. Is it Obi or Obi?
Obi, so through the chair, thank you for the question. It is a mechanical arm. So if we have a resident in a long-term care home who's cognitively well, but physically compromised, prior to this tool, staff would provide mealtime support to that person by feeding them. With this arm, the resident can actually manipulate the arm and it feeds. So it really supports residents in terms of enhanced dignity, in terms of enhanced autonomy and independence. And it's been really well received by the residents who've been trialing it for us. They said it's really been a game changer. It's difficult when people run into challenges physically and become dependent and really want to maintain that independence. So it's been a really pretty tremendous piece of equipment.
Oh, that's fantastic. And just one final question through you, Chair, to the Commissioner. Now, we won a Seniors Award. Can you just speak to that very quickly, and then that'll be it for me, and thank you.
Through the chair, so there were a couple of seniors award at a recent provincial session. One of the awards was for a program called the Positivity Program. It's a program where pets are brought into the home and there's an opportunity for staff to adopt those pets. It's been a huge hit with the residents in the home, and actually we've had really significant success with being able to find homes for the pets as well. And then often the pets, after they find a home, come back to the home to visit the residents. So it's been really a nice program. The other award that was received was by the supervisor for clinical documentation and informatics, Rana Perrin, who received a leadership award for the work that she has done related to technology, specifically in long-term care. She's done tremendous work leading practices across Canada, actually, some of which she's presented on in the States, and has really done a lot to advance the work that we're doing in senior services. So it was very nice to see her recognized for that work.
Fantastic. Thank you.
Thank you. Next, I have Councillor Olson.
Yes, thank you, Chair. And I have a question for staff with regards to 15 to 2026, and it's respect to page Appendix 1, page 1, in the wound care pressure sores, that type. I think that's what I'm speaking about. What measures have we taken to make sure that that comes down? Because that looks like it's the only offside item that we have. We're performing admirably and everything else. Have we got the resources in place to fix that?
Staff?
Good afternoon. Through you, Chair, I'm Paulo Varias. I'm the Director of Senior Services. So within Senior Services, we're actually implementing a lot of different technologies to make sure that we're actually address the wounds of residents in long-term care. we are experiencing significant changes in terms of how we are approaching wound care in long-term care. We're seeing a lot of residents coming into long-term care experiencing different types of comorbidities, a lot of physical mobility issues that predisposes them or puts them at a higher risk of developing pressure ulcers. So what we have been doing is really managing it with first diet and nutrition, making sure that our residents are actually receiving appropriate diet and nutrition with the support of a dietitian as well as our amazing nutrition team at our long-term care homes. We also provide supplements with our residents. When it comes to technologies, we're actually using a tool wherein we're actually able to measure the wound using an iPad or a tablet, and we're able to actually determine the prognosis of a wound throughout time. It's one of the technologies that we've started here at the region and is now being implemented across Canada, and we're one of the first pilot for that program. The other one is we're also using different type of treatment surfaces or mattresses treatment surfaces in our long-term care homes, and they're amazing because it actually relieves pressure. We're using air to actually relieve pressure and so that we can better manage the wounds. In addition to that is we've also worked with University of Niagara Falls to actually develop what we call a product picker, wherein we're able to actually identify what kind of treatment we should be implementing when it comes to our interventions for residents who are experiencing pressure ulcers. So those are some of the technologies, and definitely we were able to provide and share more information and provide you a tour in any of our long-term care homes to showcase the work that we're doing when it comes to our wound care program.
Okay. Thank you, Chair. That was a very complete answer, I would say. An excellent answer. Thank you.
Thank you.
Thank you, and thank you to staff. Okay, seeing no other speakers there, I'll call the question. Please vote electronically. Okay, that has passed. I will now ask, is there any other business? Councillor Whalen.
Thank you, Madam Chair. Just a couple of things. I got a brochure in the mail today from the Niagara Health Foundation. So being our new hospital, we're looking at a little bit better than a year off. And there's some exciting renovations and things that will be offered to Wellness site. Can we ask staff to arrange for somebody from the NHS to update us on both of these projects coming forward?
Yes, I think that's maybe an update on the renovations.
As well as the new NHS South Niagara site, as well as the well and upgrades and
yes,
the services that will be offered.
I'm having staff nod their head yes.
Quite perfect. Okay, thank you. And just one more thing also. Back about a month ago, sorry?
Go ahead.
Okay, back about a month ago, we had a situation in Thorold where we had a mother and a single daughter that were burnt out of their townhouse. So situations occurred that she slept in her car in her driveway the first night. She phoned 211, was told that she could get a shelter. Well, it's not really practical to have a mother and a single mother and a child go to a shelter. The mother, yes, but I can't see a young child to go there with her. So we tried to get somebody at the region and was unsuccessful. The next day we finally got a hold of Red Cross. They put her up in a motel for 2 nights. The nonprofit housing had to come forward and put her up for a few more nights. And then they were moved to a seniors center for the next wells. So eventually, coming next month, she's going to get her place of her own. Can we have somebody give us a report of what we can do at the region to simplify this for people in situations like this?
Staff,
everybody we reached out to hit a dead end. Like I say, hate to see anybody with a young child sleeping in a car in the driveway of a burnt out home.
Staff are going to address.
Through the chair, around the specific item that you mentioned, Councillor Whalen, I can give you a call on that one to circle back. And
that'd be great. Just like I see something permanently coming forward in case you get the situation again. I know we talked prior to this, but I know the situation has been fixed, but just the circumstances. Like I say, 211 proved nothing other than we'll get you to a shelter with a young child, which isn't really practical, I don't think.
Yeah, and I think through the chair, so I did make note when you reached out to me some time ago in terms of the concern there, and the staff made the adjustments so that that would be a different response moving forward. There was some miscommunications through that situation.
Okay, give me an idea what happened, Henry. That'd be great. Appreciate it so much. Thank you.
Thank you, Counselor. Seeing no other business, going on to number 9. Does any member wish to go into closed session to discuss the confidential item? Okay. All right. All right. Can I have a mover and seconder to recon, oh. Wait a minute, it says to reconvene. Oh, sorry. Right, can I have a mover and seconder for confidential Com C 19-2026? Councillor Rittavine and Councillor Encina. All right. Call the vote. Please vote electronically. Okay, and that is done. That's moved. Next is next meeting. The next meeting will be held on Tuesday, August 11th, 2026 at 1 p.m. in the Council Chamber Regional Headquarters. I just want to thank everybody and staff for all their patience and input today. Have a great day.
Take care, folks.